I'm Melita Kenealy and I'm a consultant haematologist. I work at Cabrini Hospital in Melbourne. I've been researching and treating people with myelodysplasia or myelodysplastic syndrome, MDS. MDS or myelodysplastic syndrome is a disease of the bone marrow, and the bone marrow becomes dysfunctional, so it's not able to produce the blood cells as it should. So often people have low blood counts or ineffective blood cells. So they have troubles with anemia or a lowered immune system and have a risk of bleeding. They also have a risk of it becoming more aggressive or turning into an acute leukemia. In the last decade, we've had the availability of Vidaza or azacitidine, which is a new treatment for MDS, and in fact the first one that had become available for MDS. So that's an injection that's given on the tummy for people with higher risk problems with their MDS, and about 2/3 of people respond and their bone marrow gets better. We're learning a lot about the bone marrow in MDS and the different faults that can happen in some of the genes and the chromosomes to cause the disease. That means we can start to use some targeted treatments or develop targeted treatments to target those specific abnormalities. So at the moment we're learning about these gene faults, and there's a few drugs that are coming out on clinical trials and gradually becoming available that'll be relevant for some of those subtypes of MDS. It's really important that people with MDS find out a bit about their disease. It is a difficult one to understand, and places like the Leukaemia Foundation website have a lot of information about MDS, and you can be put in touch with other people with a similar disease. So for people that are interested in what's happening overseas in MDS and clinical trials and new treatments, the MDS Foundation have a great website. They have information about what's happening overseas, and they also have some resources, diaries and apps that you can download. So some people with MDS need regular blood transfusions because they have anemia or low red blood cells. Sometimes people feel better after the transfusions, and sometimes they don't seem to make such a difference. We don't really know why sometimes people have a better response to a transfusion. Sometimes it's the number of units that people are given or the blood level before the transfusion, and it's just sometimes something that we can't explain. So one of the common questions I get in MDS is for people that are on regular blood transfusions, at what blood level or hemoglobin level they should have a transfusion. And there's really no one answer, and it really needs to be an individualised decision, and it depends on how people feel at different levels and what their other medical conditions are.